What I've been able to provide for my patients is a surgical experience with much less pain and suffering. And that's essentially what I've devoted my career to, is performing surgery with less impact on my patients.
I have a dear friend, Dr. Luann Chan, who I work with, is Swedish, and I went to her and I says, I'm in trouble. She says, I've got the perfect oncologist for you. It was Dr. Kramer with Swedish cancer. And I went to see him and he said, you have bilateral kidney cancer and it's quite large, but I have somebody in mind that I know can take care of you. About a day or so later, I get a call from Dr. Porter. On the phone, he just calls me up and he says, Mary, he goes, I'm Dr. Porter and I saw your scans. You've got 2 large tumors on both your kidneys.
In our first interaction, he had told me it was in the top 20% of difficulty of where the 3.8 centimeter cyst was located, and it would take some surgical expertise to remove it in a manner that you could retain a lot or most of your kidney function.
He goes, don't worry, I'm going to take care of it. He goes, I've looked at them, I know what we're going to do. We're going to do Da Vinci on there, and we're going to take care of you.
So robotics and surgery are one of those pivot points that people look at that dramatically change the whole course of a specialty, and that's what robotics did. Before, when we used to do open surgery, we'd keep people in the hospital for over a week. We now can do it with small, tiny incisions, be able to send someone home the next day, and be able to cure them and have less complications. It's been a dramatic change.
Teamwork is essential for in any OR, but especially in robotic surgery, because it is a specialty.
I like the fact that, like I said, every day that he comes in, it's like he's 100% there. You know, he's giving the best that he can all the time. And you don't always get that. And you take your chance as a patient coming into the OR. You know, even if you do your research and you Google your surgeon, you're only going to get so much information. You know, and I can tell people with confidence that Dr. Porter is the best that I've seen, even after 10, 13 years working with them. I mean, there's no doubt about that.
That's what it's all about. At the end of the day, you don't want somebody that's only done 2 of these. You want somebody that's done 2,000 and has 1,999 successful. I mean, I could not find one bit of bad information about Dr. Porter. He has the highest remarks across all the peer groups.
The one word that seems to come about in Jim's interaction with my patients, pre-op, post-op, is confidence. And I think confidence can simplify a complex issue, because a lot of times patients are looking for direction. Their world's upside down. Their world is spinning. Their world is complex with this diagnosis of cancer. They come into Dr. Porter's office, whether they say it or not, what they really want is make this simple.
Well, the day of the surgery, I was really at ease. It's kind of a two-pronged process. You're in a little bit of a waiting room down on the main floor, and so my mom and dad were there, my wife was there, and then you go up to the actual room where you're kind of in line to be scheduled, and everybody's looking at the computer to see who's next. And Dr. Porter came in and, you know, held my hand, gave me a reassurance of confidence. The anesthesiologist was there. She was wonderful. They took me down to the machine. I got to see it, and then I don't remember anything except waking up in the recovery room.
He's regarded nationally by other surgeons as the consummate teacher of robotic surgery. But he's also a leader in that he knows how to represent robotic surgery in a large health system. And I've watched him in front of administrators and others make the case for what he's doing in a way that very, very few individuals can do that.
Everything is livable like normal again. What can I say? I'm just very thankful and grateful.